time now for a new way to get your perfect smile. If you're looking for a more holistic approach to dental care, from ceramic implants to alternatives to traditional braces, Dr. Alexis Yip from Swiss Biologic Dentistry is here to break it all down. Thanks so much for coming in today.
Thank you for having me. I'm happy to be here.
Yeah, why would you say your practice is so unique?
Well, you know how when you walk into a dental office, a lot of times when you think dental offices, it's very cold
and sterile. That's what I was going to say.
Yeah, it's not warm, nothing like that. A lot of people don't like to be at the dentist, and it's a very common thing. And so the way we design the office, when you walk in, you don't even feel like
it's gorgeous.
It's a dental office. Yes, it's very warm, cozy. There's a lot of plants. There's a lot of wood accents, and so you want to be very comfortable because dental work is not very comfortable. What makes us unique, besides that, is that we practice holistic dentistry. It also goes by biologic dentistry or integrative dentistry. It goes by a couple different names, and it is a lot different than traditional dentistry, just because we try to be as minimally invasive as possible, as well as biocompatible materials. So I think fluoride has been very popular, the topic of fluoride right now, BPA, microplastics, metals that shouldn't be in the body. So what we do there is we try to stay away from a lot of materials in dental products that would have fluoride in it, BPA. A lot of people have existing metal fillings in their mouth or metal crowns, titanium implants, and you know, we want to do a holistic approach. It's not just what's in the mouth, because the mouth is part of the body, and you don't know what that metal and all those other chemicals that's inside the mouth, how it affects the rest of your body. And so detox is super important nowadays, especially because, you know, fatigue, inflammation, autoimmune disorders are so common nowadays, and all of that could be linked to the mouth. So we take a very holistic approach by seeing how the mouth connects to the rest of the body.
Yeah, and that's why it's so important to you too. What about, you were talking about ceramic implants. They're becoming really popular. Tell me about that.
Yes, so titanium implants, I think, are the most prevalent implants that are placed, whether it's placed by an oral surgeon, a periodontist, or even regular general dentist. But titanium implants are not 100% titanium. They also have other trace elements, other metals in it. So it is more so a titanium alloy. And so for people who do have metal sensitivities, metal allergies, they might react to these titanium.
So that's why you use
implants.
Ceramic.
Exactly. It's more biocompatible. The gum tissue likes it a lot more. Plaque and bacteria don't stick to it as much. And then sometimes if it's closer to the gum surface, if you have a titanium implant, you can see that grayish hue kind of shining through. So with the ceramic implant being white, it's a lot more aesthetic.
What about braces? You have alternatives to braces.
Yes. So what we do at the office here is MyoBrace, and that is a lot more holistic than all the metal and the brackets regular traditional orthodontists place in, because a lot of times people think that braces are more so for the teenage years, but by then a lot of the growth, especially after puberty, has been slowed down.
Yeah.
And so what we want to do at Swiss Biologic is kind of work with the jaw development. You know, as kids are 7, 8, 9 years old, that's when they're doing their growth spurts, really, and their jaws have not finalized. Yeah,
absolutely.
So the tongue muscles, the cheek muscles, the lip muscles, that is meant to be the retainers of the teeth. So it's like guiding through exercises. How to place the teeth, not so much as pulling it where they don't want to be, and then you have to wear retainers for the rest of your life.
And another thing that you do that I want to get to is you have a pinhole technique for gum recession.
Yes.
Tell me about that really quick.
Yeah, so this pinhole surgical technique was invented by Dr. Chow. He's out in California. He's been doing this since the early 2000s, but he is the inventor of it. It's trademarked. And what's different about the pinhole surgery is that regular traditional gum surgery, they take donor tissue from your palate. They cut that out, then they move it to another part of your mouth to put it on 3 teeth. So it's a very slow process. There's only so much gum tissue that you can move to place around. But people have gum recession all around their mouth. They might have root sensitivity. It's just not very good looking because the teeth look longer. And so with pinhole, there's no cutting involved, there's no stitches involved, there's no donor tissue involved. You put a little hole in the gums, you insert instruments in there, lift the gum tissue up, and then stuff a bunch of collagen to bring the tissue down.
So much.
Yeah.
Such great information too. And you have a special offer if anybody wants to learn more.
Yes. We want more and more people to take advantage of this, and it is a fairly costly procedure, but you can do it all in one session. So that's what's wonderful about it.
Okay.
And so I do want this to be more affordable to a lot of people. So we are offering 10% to anyone who is 10% off to anyone who's watching the segment.
Right, very good. A lot of great information. To learn more, you can visit SwissBiologic.com or call